Hi guys, Dr. Galante. The term sciatica is used a lot, and oftentimes people will come in my office and say, I think I have sciatica, and they have nothing close to sciatica. So the term is kind of used inappropriately, and it's used for a variety of different conditions. So there's a lot of misunderstanding about sciatica, what it is, what causes it. So I want to clear up some of those misconceptions right now. So sciatica is usually caused by a disc problem, by some type of disc herniation. So if you look here, you can see a disc. On the outside of the disc is made up of cartilage, just like the cartilage in your knee. And on the inside of the disc, there's a jelly-like, fluid-like substance called the nucleus pulposus. So when a disc starts to get damaged, a disc will bulge. And when it bulges, the disc just kind of pushes out a little bit. And disc bulges are usually relatively easy to treat and usually respond very well to treatment. Now, when we get increased pressure on the disc, then we can get a disc herniation or a prolapse. Now, there's a lot of different terms that describe a disc herniation. A slip disc, a ruptured disc, a protrusion, an extrusion, a prolapse. And all of these terms basically mean the same thing. There's some type of disc pathology, some disc damage. That's the root of the problem. Now, when you get a disc problem, you're going to get local pain, meaning you're going to get pain in the back, maybe a little bit into the hip and the buttock. And we know from studies that the disc is the most painful structure in the lower back. So it doesn't take much irritation to the disc to cause some pain. Now, when the disc herniates, it can cause sciatica. So what a herniation is when that outer cartilage tears or ruptures, and that fluid from the inside pushes out against the nerve. And that can cause your classic sciatic pain, where you get pain, numbness, burning, weakness down into the leg, even into the feet, even into the toes. Now, we can kind of know exactly where the disc herniation is by where the pain is in the leg. So if someone comes in and tells me, hey doc, my back hurts, goes in my hip, goes down the back of my thigh, down the back of my calf, into the bottom of my foot. I say, so, great, you got an L5-S1 disc herniation with resultant sciatica. We haven't diagnosed it already. I haven't even examined them yet. And the reason that is if you look here, when that bottom disc, the L5-S1 disc is damaged, is herniated, it's going to press on this nerve root called the S1 nerve root. And that causes pain in that distribution. That's where that nerve goes. So that bottom nerve root in the lower back goes down the back of the thigh, the back side of the calf, into the side and bottom of the foot. So we'll see those classic symptoms. Now, someone comes in and says, hey doc, it goes into the side of the thigh, in the front of the shin, down to the top of the foot. Well, that's L4, L5. That's the L5 nerve root that's being irritated from the disc herniation. So we can know exactly where the disc herniation is that's causing the problem, judging on where the leg pain is. Now, when you go up the lumbar spine and the L2, L4, and the upper lumbar spine, when you get herniations in that area, can cause pain in the front of the thigh, down the inside of the shin, and even into the inside of the foot at times. But most of the herniations are down here at L4, L5, and L5-S1. Now, sciatica is a very serious condition. It can ruin your life. It can cause you not to be able to work. It can put you on disability. It's the number one cause of disability worldwide is low back pain. It can cause you to be addicted to opioids. It could prevent you from sleeping well. It could cause you to lose your freedom, lose your independence. And I don't want to see that happen to you. So, do we treat sciatica? Oh, yes, we do. Matter of fact, I wrote a book on it. I wrote a book on sciatica. And I wrote this book a few years back, which you can download free on my website. And I wrote it because I was tired of seeing people come in suffering needlessly for months, years sometimes, because they didn't get the proper treatment. And at this point, they're usually addicted to opioids. They haven't worked. Their life is a mess because something that we could usually treat fairly easily. So if you or a loved one are suffering with sciatica, don't wait. Let's get together. Let's see if we can help you. If I can help you, I will tell you that. If I can't help you, I will point you in the right direction and help you find someone else that can. I work with a lot of local therapists, pain management doctors, orthopedic surgeons. The vast majority of people never need to see those people. But if you do, I will tell you. So let's get together for a consultation. Let's see if we can help. You have a great day and be well.